And the most effective types of interventions, according to evidence, are the non-pharmaceutical, which means that the non-medicinal.
You're listening to Teen Talks, Breaking Free from Tobacco and Nicotine Grip, a podcast brought to you by the Asia Pacific Learning Collaborative Network on tobacco and nicotine control. In this episode, Tobacco Timeout, Outsmarting Nicotine.
Hello there, Nico-free teens. We are on to another episode of Teen Talks, Breaking Free from Tobacco and Nicotine Grip. I am your Nico-free friend Hannah from Malaysia, and today we are going to have another fun talk time and understand further about tobacco cessation. I hope you were able to listen to the previous episodes of Teen Talks and know well the health harms of smoking and vaping, especially in the young. Today, we are glad to be joined with an expert doctor friend to help us know how we can outsmart nicotine. Friends, may I introduce you to our partner doctor who is a clinical pharmacist and the past president of Malaysian Association of Adolescent Health, whose main interest in public health is tobacco control since 2001. He is the coordinator of the first dedicated and multidisciplinary Quit Smoking for University Science Malaysia, Health Technology Assessment Expert in Smoking Cessation, and 2024 recipient of Outstanding Child and Adolescent Advocacy Service Award by the Malaysian Pediatric Association. Everyone, let's hear it from Prof. Muhammad Haniki Nik Muhammad. Good day, Prof. Haniki.
A great day to you, Hannah, and also to our avid Teen Talks listeners. A smoke-free day, everyone. I'm really excited to do this podcast with you all.
Same here, Prof. Haniki. Let's dive into this challenging part of tobacco control, tobacco cessation in the young. From the previous discussions, we already have the knowledge of how powerful the influence of smoking and vaping can affect our bodies and behaviors. What should be the first step in helping teens to quit, Professor?
You are right, Hannah, especially those who got addicted to the nicotine in smoking and vaping products. It takes a lot of discipline, a lot of willpower to overcome this. And the most effective types of interventions, according to evidence, are the non-pharmaceutical, which means that the non-medicinal, and the habits part that needs to be intervened, which does not require any medications. It is important that cessation interventions be provided to adolescents in a confidential manner because the building of rapport is very important of a trusting relationship between the adolescent and the health provider. So the behavior intervention or support that I mentioned to you to help adolescents quit smoking and vaping include, firstly, develop a plan to quit successfully. As you have heard before, if you fail to plan, then you plan to fail. Isn't that right, Hannah? The second one is to develop strategies to deal with cravings and triggers. Thirdly, develop healthy coping strategies for stress and anxiety. As we have listened to the previous podcast, many people they use nicotine to overcome or cope with stress and anxiety. Last but not least, provide support throughout quitting process.
It sounds simple, easier said than done. But can you help doctors to give more specific examples and steps on doing it?
I'll be happy to, Hannah. This is what we call the elements of a successful quit plan. The first part is to quit completely. Now, they can do this by gradually reducing until quit date, or they quit cold turkey, which means completely on the quit date. So, it may be the hardest thing to do, but starting to quit is the most crucial. In the quit date, teens must stop the use of all tobacco and vaping products and throw away all the tobacco products and paraphernalia. This would include their matches, other than the cigarettes, their vapes, but you know that this would need to be disposed of correctly because of the lithium batteries and that can endanger the environment and so on and so forth. All these products would need to be get rid of because the look and the smell can trigger the want to use it more than ever before. Other than quitting completely is knowing the triggers. So the teens would have to identify the people, yeah, because the presence of other smokers or vapors can trigger their craving to smoke or vape. Also, the places, if they frequently smoke or vape at a certain location, so that can be a trigger. Also, feelings, including stress and anxiety. So they need to identify when they have these feelings. So there are also situations that may cause the teens to want to smoke or vape. So they have to develop a plan to manage these triggers. Next is to be aware of withdrawal symptoms. I think in the previous podcast, Hannah, the listeners have been introduced to the concept of withdrawal symptoms, which are the reverse of the effects of nicotine stimulation and the ensuing neurotransmitters. Yeah. For example, dopamine would cause pleasurable effects. GABA, for example, is a neurotransmitter and they would reduce level of stress and anxiety. But withdrawal means once a person reduce the intake or stop using nicotine-based products like tobacco or e-cigarettes, then the reverse effects would occur. So they would have displeasure, they would have increased anxiety and tension. These withdrawal symptoms can also include craving, irritability, and in some, increase in appetite. Okay, so for these withdrawal symptoms, there is a strategy that we call DEAD, DEAD. Okay, that stands for delay, escape, avoid, and distract. So they can expand on this DEAD strategy, do something else, drink water, plain water, not caffeinated drinks, deep breathing, okay, and many other things. And next step is have a good social support. For this, they need to tell others that they are in the process of quitting or they're going to make a quit attempt. So people around them hopefully will support quitting. So they can be in the form of family members, friends, or loved ones. Okay. And they need to get the support from these people so that they would be motivated and these people can encourage successful quitting. And most importantly, Hannah, is self care. People tend to forget about themselves. So consider supportive behaviors such as healthy eating. They need to switch to healthy habits. So start eating more fruits, yeah, fresh vegetables and fruits, and do exercise. Or some people increase their mindfulness, getting more aware of the situation and about themselves, and also meditation and prayers. These have been shown to help reduce stress and anxiety and improve their self care. So, the behavior interventions that I mentioned earlier, Hannah, can come in several modalities, including both virtual and also physical options. For example, that's the telephone quit line. In certain countries, this is even offered as toll-free quit line. So teens can just call and get help from trained personnel. Next, we have text messaging support as well as web-based interventions. I think the getting more popular now is the smartphone apps. Yeah. So credible bodies, professional bodies, okay, even government bodies, they have apps that can be downloaded to the smartphones and be used to help them quit successfully. Okay. For in-person or physical intervention, they can make an appointment. They can go to see their healthcare providers, either as individual, one-to-one, or maybe in a group-based intervention. So all this can be obtained from credible sources.
I have heard that there is the 5A strategy. What is this and how is this done for our age group?
So you have heard about the 5 A's. This is actually the behavior intervention, which is part of the 5A strategy, where the health professionals should actually first ask about tobacco use to identify whether the teen is using tobacco products or not. And this can be done for all teens at every visit, either with or without the parents or the family members present. If they come in on their own, yeah, more likely that we can get a truthful answer. But if they come with their family members, sometimes they are shy or reluctant to admit they are using any tobacco products. But anyway, the healthcare professional can ask about tobacco use. Next is to advise, strongly urge all tobacco users, smokers or vapers, to quit, especially on the premise of health. Next, A is to assess. They can determine the readiness to quit by assessing the willingness to attempt to quit smoking or vaping. They can also assess the level of nicotine dependence. I mentioned about the use of certain tools, for example, hook on nicotine checklist. There's also Fagerstrom test for nicotine dependence and other tools that can be used for this purpose. The next A, Hana, is to assist. This is where most of the time will be spent with the teen. Okay? Because the provider would deliver interventions, assistance for the teens attempting to quit, and mostly in the behavior intervention that I mentioned earlier. Last A, Hana, is to arrange for follow up. So that's the schedule that's recommended. And this follow up is to review the progress and to re-evaluate the intervention. Not only the behavior, but in certain cases, maybe the adolescent or the teen would require medications. Okay? So this will be reviewed accordingly at every appointment. And if there are any issues or problems, this will also be addressed as appropriate.
Now that you mentioned pharmacotherapy, can smoking cessation medications like the nicotine patches and some prescription drugs be used in adolescent smokers to help them quit?
Oh, excellent question. Generally, all approved cessation medications are indicated for smokers who are at least 18 years old. And these medications are categorized into two: nicotine or non-nicotine based. So, non-nicotine containing smoking cessation medications can be taken orally, for example, in the forms of tablets or pills like varenicline or bupropion. However, they have not been studied. They need clinical studies in order to be approved to be used in those below 18 years old. So without these studies, we cannot recommend the use of the medications because we don't know the safety profile. We don't know whether they are going to be effective or not. So in God we trust, in others we need data. So without data, we cannot recommend the use of non-nicotine based medications for cessation in teens.
Oh, I see. When can this pharmaceutical treatment of nicotine dependence be used in the young?
Okay, I did mention earlier that some adolescents would require medications, right? So, yes, now I will explain that the use of some nicotine based medications, such as the nicotine patch that you mentioned earlier, in adolescent smokers can be considered on a case by case basis, especially when we assess their level of nicotine dependence and we found them to be of moderate or high level of nicotine dependence. Also, they are motivated to quit, or once they tried quitting, they have severe, unbearable nicotine withdrawal symptoms. I'll talk a bit on the evidence. So, research on the effectiveness of nicotine replacement therapy or NRT for helping adolescents quit successfully is somewhat limited due to the lack of adequately powered studies. We need good numbers of participants. So, we don't have many participants in many studies. However, we know that there is no evidence of serious harm from using NRT in adolescents under 18 years old. And we also know that the effectiveness for NRT for adults, and because of the severe harms of tobacco dependence, many authorities and organizations, such as the American Academy of Pediatrics, they do recommend that NRT can be considered off-label, meaning that it's not indicated, but if it's required, so the clinical decision to use it is allowed for those who are moderately or severely addicted to nicotine and having the motivation to quit, as I mentioned earlier. But do remember that in most countries, parental consent would also be required before any medications can be initiated or prescribed by a healthcare provider, okay, for any forms of NRT in adolescents. This would also cover NRT products such as the gums. Of course, I mentioned earlier about the patch, and they also come in lozenges in certain countries, or inhalers, or even mouth sprays.
Please discuss further how are these medications given since our region seem to be on the verge of this nicotine addiction problem.
Right. So if we find that many of the adolescents having severe nicotine dependence and also severe withdrawal symptoms upon quitting, then we can consider the nicotine replacement therapy. If the patch is the most suitable to be used for smoking cessation, we would try first a short term, like 1 to 2 weeks use, okay, with counseling. Counseling is mandatory, is compulsory for all. Okay, medication is on case by case basis. So this short term is not the usual 12 weeks period that we generally prescribe for adult smokers. And we know that there are two types of nicotine patches, the 16-hour patch and also the 24-hour patch. So sometimes we give 16, sometimes we give 24, depending on certain criteria. For example, time to first cigarette. The faster someone start having the first cigarette means the higher the level of nicotine dependence. And sometimes we need to give 24-hour supply of nicotine to delay that time to first cigarette. But regardless of whether 16-hour or 24-hour patch, both deliver nicotine through the skin so that it will go into the blood vessel and then provide the nicotine based on the strength. They have three different strengths: the highest strength, moderate strength, and the lowest strength, because the manufacturer recommends to start with the certain strength for certain duration and then taper down accordingly, whether over a few weeks, okay, or maybe 1 or 2 months. So a health professional, especially those who are certified as smoking cessation service providers, will recommend the suitable starting dose based on the time to first cigarette and also the number of cigarettes per day. Okay, if the highest strength is chosen, the first dose would be given, use one patch each day for maybe a few weeks, can be up to 6 weeks, and then the step down would be use the next lower dose for another 2 weeks, and then step down is the lowest strength or lowest dose for the final 2 weeks. If the gum is chosen, we have to determine whether to use the 2 milligram per piece or 4 milligram per piece gum. So once the strength is determined, we advise the correct technique of chewing and use one piece every 1 to 2 hours for the first for 6 weeks, and then chew one piece every 2 to 4 hours for another 3 weeks, and finish off with chewing one piece every 4 to 8 hours for 3 additional weeks. In some countries, Hannah, they have NRT or nicotine replacement therapy in the form of lozenges. So this is just like using any lozenge, and they can come in various strengths: 1 milligram, 2 milligram, or 4 milligram per lozenge. Just let it dissolve in the mouth. Do not bite, crush, or swallow it. And use one piece every 1 to 2 hours for the first 6 weeks. Then one piece every 2 to 4 hours for 3 additional weeks. And finish it off with one piece every 4 to 8 hours for the last 3 weeks. If the healthcare provider starts an adolescent on a lower dose, but it doesn't seem to be helping much, so the provider can then assess adherence, technique. If everything is okay, then can consider moving the patient to a higher dose, or even consider a longer duration of use. Okay, and the weaning or stepping down period. So it can be extended. That's what I'm saying. Both the adolescent and healthcare professionals should work together to wean the NRT over time, meaning that we treat them for a certain period, yeah, few weeks to few months. Then during that time, we taper it down to stop the NRT. We don't give it continuously after the period of 3 months, for example. Especially for those adolescents who feel that they have no longer at risk of relapsing or returning to tobacco or nicotine use.
So these are prescription medications. Are these available in our region? And should we have our parents with us when we buy them?
Okay. There are many parts of your question. The first one is, are they prescription medications? In some countries, yes, they have to be prescribed. So meaning that they would have to see the doctor, and depending on the system of the country, they would need to bring the prescription to the pharmacy, and the pharmacist would dispense these medications. As I said earlier, because these medications are for above 18 years old, you need to have parental consent. Okay, so it would be wise to let them know, I mean, the parents know that you need this medication to help quitting attempts. And in some countries, these products are non prescription medication. For example, in Malaysia, the gums and the patches are over the counter OTC products. So they don't need parental consent. They're just like going to the store buying paracetamol for headaches. Okay, but it is more beneficial to seek help from the health professionals before using the NRT products to determine that they are suitable and safe. And as I said earlier, again, the best option is to get your parents to be involved so that they can also provide consent.
How long should these steps in quitting smoking and vaping? Is it weeks or months?
I mentioned about the schedule earlier. So in most cases, it will take many weeks. Can be up to 6 weeks, 8 weeks, or 12 weeks, depending on the level of nicotine dependence and also the severity of their withdrawal or craving upon quitting. Especially those when they chose to quit cold turkey, meaning that they stop abruptly, so they tend to have a more severe withdrawal, yeah, and intense craving. So they would require longer duration and higher dose of medication. Whereas someone who quits gradually, they would have less intensity of the nicotine withdrawal over time. Okay, so if they manage to quit for about 1 month, is already a good predictor of successful quitting at 3 months and later 6 months. So it's a case by case we treat on an individual basis because no two smokers or vapors are similar. Some vapors, they use high concentration of nicotine in their liquids. So they need to taper down, for example, reducing the strength of the nicotine in their liquid every 1 to 2 weeks by about 10 to 20%. So the higher the nicotine content or strength that they use, the longer the duration that they need in order to reduce it week by week, about 10 to 20%, slowly, gradually, reducing the nicotine concentration over time until it gets to zero.
What should one do if they fail along the way in this quitting process?
Oh, okay. If they are unsuccessful with their first attempt, we advise them to try again. Learn from the previous experience why they were unsuccessful. These are valuable teaching moments or even personal triumphs that they can use to build on other attempts for successful quitting. Yes, even studies have shown that some people take multiple attempts. It can be six, it can be eight, it can be more than that before they can quit successfully because there are differences in the situation, in the level of nicotine dependence at the time, their self efficacy or confidence, the help that's available. Yeah, the things that trigger smoking or vaping again. So these are all different. But the good thing is keep learning from this experience and use them for future successful attempts.
So, steps in tobacco cessation in the young is indeed challenging. So, what can parents do to help?
Yes, for this part, we encourage the parents to keep talking to their children about dangers of smoking and vaping, even when they're still young, even at the kindergarten stage, and then continue the conversation going appropriate to their level as they get older. So, yes, keep an open and a good line of communication and explain to them why you don't want them to try a single puff of cigarette or a single puff of vape. Okay. And also explain to them the industry tactics of targeting them. You know, this year's World No Tobacco Day theme is on the industrial tactics targeting youth. So they need to know that they are being targeted by the tobacco and vape industry. Then parents can explain that even smokeless tobacco, the shisha or hookah, and now e-cigarettes are all harmful products of tobacco. They are all dangerous. They have different specific dangers, but they are all harmful and dangerous. And especially because they promote nicotine addiction and dependence. Okay? And parents can also prepare their kids for peer pressure. I know this is very common for adolescent. You see one friend vaping or smoking, and you think it's cool, you think it's trendy, and you're curious. You think it's safe because it smells nice, it's fruity flavor and whatnot. But these are essentially industrial tactics to start you on nicotine abuse. It's not practical or possible for adolescents to stop befriending these friends. But you can advise them saying that, yes, if you want to vape, if you want to try smoking, I'm still going to be your friend, but I would like you to stop as soon as possible because they are harmful. Hopefully, they will listen to you because friendship supposedly is more beneficial and meaningful. But for you yourself, if you feel that you need to avoid this kind of friends for some time, not forever, then you maybe distance yourself. And when he or she goes to places that he or she will start smoking or vaping, you try to avoid, excuse yourself so that you will not be in the situation that you are exposed to seeing people vaping or smoking because that will increase your risk of trying. But also remember the harmful effect of secondhand smoke or secondhand vapor. So this is also dangerous. Okay, parents need to be aware of this. Make sure they set a good example by not smoking or vaping themselves. Or if they are smokers or vapers, attempt quitting. And if they know that their child or children are also smoking or vaping, get them on board as well. Quit together, help each other, support each other. Okay. Make sure that the house and cars or any mode of transportation are made smoke free. So no smoking in the house, meaning that totally out of the house. It's not like having part of the body inside the house, but the hand and the head is outside the window. No, it means totally out of the house. Okay, out of the car. If they have to smoke, stop the car and get out of the car, because we don't want the air to recirculate and expose the passengers to secondhand smoke or vapors. Okay, and make sure all the places where the children spend lots of the time are made tobacco free. So this is also some of the things that parents can do. They can also advocate. They can also join organization or ensure through the parent teacher association that activities are done in the school, awareness campaigns, okay? And also be vigilant, know the latest forms of e-cigarettes, because they can look like thumb drive, they can look like toys, they can look like gadgets, they can look like watches and whatnot. So be curious, ask, talk to the children and be supportive, but at the same time, advocate and emphasize on a tobacco and smoke-free environment.
I understand that smoking and vaping is a public health problem. What can governments do to address this and make an impact in society?
Yes, we know that the government should develop policies to protect the public health. So if there's an issue with the policy, then we need to ensure that the government, the policymakers, are able to table such policies and then to implement them accordingly. So to help government all over the world implement good tobacco control strategies, the WHO, or the World Health Organization, has actually come out with a treaty called the Framework Convention on Tobacco Control, or better known as the FCTC. So they provide the minimum standards to control tobacco effectively, and through the strategies that's known as Empower. MPOWER. So if you go to the WHO website, or you can Google FCTC, Empower, it will explain all this to you in greater details. So the first is M for monitoring. So monitoring of tobacco use, of e-cigarette use through national studies or even smaller studies, and in this case focusing on adolescent, so that we know whether there's an increase or decrease or changes or no changes in the prevalence of smoking and vaping among adolescents. So next is to protect the non-users from being exposed to second-hand smoke, third-hand smoke, or second-hand vapor or aerosol. So E is to ensure that effective ban on tobacco advertisement, promotion, and sponsorship, yeah, or TAPS, tobacco advertising, promotion, and sponsorship. As you know, previously, tobacco products are promoted through activities like sports, right? Entertainment. Okay, what else? So many things. They have their ways of advertising and promoting and sponsoring activities. So now majority of the countries have banned all this direct sponsorship, advertising, and promotion, but they do it indirectly. For example, through merchandise. Yeah, they have attires, they have bags or items used by many people, even fragrances, actually by the tobacco industry using the name of the tobacco product. So we need to ban this. And we also need to remember that to reduce the appeal of such tobacco products, in the case of e-cigarettes, by banning flavors, sweetness, or designs. Yeah, we cannot have e-cigarette in the form of toys. If they are really, really, really supposedly created and sold for smoking cessation purposes only, they only be allowed to be used via prescription by healthcare providers and only for smokers. The better way is to ban electronic cigarettes because we have safer and more effective medications if needed. And to standardize plain packaging for tobacco products. Standardize plain packaging for cigarettes with graphic labels or pictorial warnings showing the harmful, devastating effects of tobacco. Also, Hannah, we need to ensure the expansion of smoke and vape-free areas and restrict selling of tobacco products, say within 2 kilometer radius of any facilities like kindergartens, schools, or government housing areas. Also need to enforce clean indoor air laws and increase the excise tax on tobacco products so that the products price would be too high, not affordable by the teens because they don't have fixed income, right? And these products will be too expensive for them to buy. And of course, it will be a great policy if tobacco products can only be purchased by people beyond certain age, like 21, for example. Or even better, 25. Okay, so if this is implemented, then the government would be able to reduce the prevalence as shown by evidence.
Thank you, Professor Haniki, for this step-by-step discussion on tobacco cessation. It is really challenging for our age group. Behavior intervention is the most important part and extremely necessary. The pharmaceutical medications comes last for the young. Support from our family and closest friends are vital in tobacco cessation, and indeed, governments play a big role in creating laws to truly protect us young people.
We can help the young every step of the way in outsmarting tobacco and nicotine. We know that industry targets the young as the replacement smokers and vapors. So avoiding this product is the first and most important step to keep your developing body and most especially your brain healthy.
Once again, thank you so much for listening to the last episode of Teen Talks, Breaking Free from Tobacco and Nicotine Grip, brought to you by the Asia Pacific Learning Collaborative Network on Tobacco and Nicotine Control. You can listen to our episodes on Spotify and Apple Podcasts. Save and add episodes on your playlist and subscribe to our YouTube channel at Nico Free Teens.
Bye
Bye
bye.
bye.
And
Stay
stay
tobacco and
tobacco and
nicotine
nicotine free, everyone.
As mentioned in this episode, there are many ways to help outsmart nicotine and quit the use of tobacco products. If you are a smoker or vapor, read through the show notes for the different resources to make your first step. Remember, quitting nicotine is a process and a skill you need to develop. So keep trying.